Hello, everybody. As I've hinted you in a previous video, I'm gearing up the Tech Talk channel for a blend of both tech and healthcare related content. Today, I have a special guest with experience in both worlds. That's tech and healthcare, Seun Odiase. So, hi, Seun, and welcome to the Tech Talk show.
Hi, Kazeem. Thanks for having me.
Okay, so let's get into things now. Could you please introduce yourself and let my viewers get to learn a little bit about you?
Okay. Hi, everyone. Thanks, Kazeem, for creating time for this. I've been following your channel, and it's actually good. Thanks for involving us in
Thank
healthcare
you.
in in your channel. So I'm Seun Odiase, a medical doctor. I have about 11 years experience in clinical practice. I was schooled in Igbenedion University, graduated from Igbenedion. Basically, I moved into, well, always been in healthcare, but decided to evolve into digital health. I've been in digital health since 2015. It's been a wonderful experience, working in between the medical doctors and the tech guys and ladies. So basically, it's been fun. It's been over about 11 years of clinical experience, and it's been good so far.
Oh, okay. Thank you very much for keeping it brief. So let's kick off things with interests that we both share in common now. That's talking about tech. Although now I'm also starting to venture into a second career in healthcare, IVD to be specific now. So since you have experience in both areas, I'd like to hear about any successful projects that you've been involved in that utilize healthcare solutions to enhance patients' outcome.
Oh, okay, good. So, speaking of Enhance, I used to work at a company called Med Enhance. That was my
Okay.
first tech experience. My first experience out of the hospital. So, worked there. We focused on online education for healthcare workers, so doctors, nurses, pharmacists. It was good to be the first person to be basically for the regulators to actually give a license to do that. Usually, doctors and nurses need to travel across Nigeria to have these update lectures and basically to keep up to date. People hardly used to go to Google or go to any online courses to do all those things. So we were the official company to start that in Nigeria, and it went very well for about 3 years. We also won I was in charge of the team that actually won Healthcare Provider of the Year from Nigeria Health Excellence Award. So that was a great one. Opened my eyes to the possibilities of technology. Secondly, working at another company, I worked in an e-health company, so where we provided electronic health records to people, to the populace, to hospitals. Basically, we're able to work with the government and be able to sign a deal to digitize about 75 primary healthcare centers in Lagos State. So that's another milestone again. Currently, where I work in a health tech pharma company. So basically, what we do is we're offering telehealth services aside from the regular business model of a pharmacy. We're transforming primary pharmacies into primary healthcare centers, offering telehealth services. So it's faster. People get access to healthcare faster, and yeah, we've had a lot of reach. We're across Nigeria and across different countries in Africa. So reaching out to people, getting trends, understanding disease trends and all that. Those are the three milestones that I could mention. Thank you.
In the area of healthcare, so I'm still not very vast yet. So I think I'm going to
So
have a
both
lot to
sides.
learn
We'll
from
learn
you.
we'll learn from each other today.
Okay. So I want us to touch on data management in healthcare next. In Nigeria, hospitals and healthcare providers, they face these big problems with handling and getting data. For instance, you find patients, having their information over and over again at different hospitals instead of just using one system to get their medical records. So I want to check with you now, based on your knowledge in healthcare, which idea, would you propose to help hospitals and healthcare generally manage and study healthcare data better?
Okay, thanks for that question, Kazim. Very interesting because I've been on this for about 6 years trying to do this unified patient record. So the first thing is interest. You can have, even if you have a great idea, you need to have the key stakeholders interested in it. Stakeholders, most people, when they hear stakeholders, they usually think is governments, private individuals, and all that. But we tend, most healthcare workers and tech professionals forget that we're all here for the patient. It's healthcare. The care there is for the patient. So even the patients need to be carried along. The populace needs to be carried along in healthcare. So one is sensitization. Why should I use this? Why should I have one record? So that goes for the patient, the government, the private sector also. Basically, one idea that is a no-brainer is on having an electronic health record system across the nation. So what I mean is basically having a health record system that is organized, gathers data, collects data for in the healthcare industry. The thing about adoption is, so there's a big difference between, people say EMR and EHR, electronic medical record, electronic health record. There's a big difference between it. So one major difference is that, and it's a big challenge too in Nigeria, each hospital, they use their own electronic medical record. An electronic medical record works for only your hospital and your infrastructure or your system. But an e-health record, it's global. It works across other hospitals, even if it's a different software or a different vendor. So what Nigeria actually needs is not an electronic medical record. We need an e-health record that cuts across every kind, no matter the kind of system you're using. It's, they basically understand each other. They have like a handshake, basically. So one is on adoption of e-health records. Two is in our data collection, right from the hospital, right from partnership with the government. We have our NIN, BVN, and all that. We need to integrate all those data. We have data in silos, so many data, so many bundles of data. Cloud is the way forward. We all know that for something as big as
Thank
this,
you.
right? So for patient identification, we need to have a system to capture biometrics, synchronize it, and basically to make them understand, or basically in a way to extract that data and pull out patients' records. Because it's quite frustrating when you go to different hospitals or even the same hospital and they can't find your record, especially if it's paper. So that's one thing. Another thing I've mentioned is integration too. What can also stop this will be staff training. Sometimes you can go through the whole process as a patient on getting your data captured and all that, and the staff, they are not actually hands-on. So change management is a very big thing. A challenge I had in the company that I worked in, where we provided e-health solutions, we had this big issue with staff training and paper. If I used to tell people that as a vendor, your biggest problem is not the next software company. Your biggest problem is paper, because immediately you're done training today, immediately you turn your back, people are already, they've switched back to paper because they think it's faster. But at the end of the day, it's what you're using that is fast for you. So a lot of sensitization, standardization, interoperability, continuous improvement, and adoption, interest, basically. Those are the main things I think can solve this problem of patient identification and records.
Okay, thank you very much. So you've touched on it. So in my opinion, too, just like you've mentioned, so I like to think that we should be able to leverage what we already have in existence. The likes of the BVN, the NINs. So
Mm-hmm.
we should be able to put them to work. It's just a matter of integration now. So and it will allow for easy access, regardless of
Exactly.
where the
Mm-hmm.
patient. Yes, exactly, and the location of the hospital too as well. Thank you for that. So, Shil, technology like cloud computing, you mentioned it, a while ago, and we also have the metaverse now, right? So, and other technologies as well, they are making telemedicine more accessible, though right now in developed countries, right? However, it seems like we're not fully utilizing these advancements yet here in Nigeria. Yeah. So, what do you think about the future of telemedicine and remote healthcare services in Nigeria, or perhaps Africa as a whole? What
Okay.
opportunities do you see, yes, in expanding the
Hmm.
services and perhaps some challenges that you anticipate? Yeah.
Okay. So the future of telemedicine, or let me just say remote care in Nigeria,
Yeah.
first thing has to come from the regulations. We can complain about the infrastructure, power issues, internet, and all that, but one thing is on regulations. How do we regulate it? Because people think telemedicine is all about video calls. That's a very big misconception. So I'm a certified digital health professional from Imperial College, and understanding that, I realized that telemedicine is any form. What's telemedicine? Use of electronic means to offer care. So that means if I'm having a call center, it's telemedicine. If I'm chatting with you on WhatsApp, it's telemedicine. If I'm sending SMS to you, if I'm doing an online chat via a website, it's all telemedicine. So that those are some of the challenges that our regulators are having. Fortunately, there's a society that's, well, it's getting popular now amongst us health tech guys. Society for Telemedicine in Nigeria. There's a group. We have a monthly meeting that we do. We discuss on policies with the government, and I have to say that the reception from the government is actually very positive. Basically, we've decided that, okay, we need you to regulate, and also they say we need you to also abide by the rules and laws that we have on terms of this policy. So one is on, I see the future where once it's properly regulated, basically it's going to be good increase like geometrically across Nigeria. We've had challenges. You can't have one size fits all. People in the north, people in rural areas can't have, well, for now, don't have access to doing virtual consultations and all that. But there are ways of reaching out to them. We have community health workers. We have their mobile apps. Their USSDs, their chat services. So I see us having different models, different modules across different sections in Nigeria, different rural backgrounds, urban areas, and all that. Also, I see a quick proliferation of investors. A lot of people are coming to invest. What I would like to see more would be more local investors rather than always waiting for foreign investors, foreign partners. Local investors and partners would be good. Collaboration also. Everyone is trying to do their own thing, but a lot of partnerships would come up eventually because that'll be the fastest way to reach out to patients. Aside the technology and policies, we're all here for the patients. The main reason, if you've built the best tool or software or telemedicine platform, if you don't have patients interested or coming on board, it's going to be a big challenge. So sensitization again from private and public sectors. Partnerships also would actually grow eventually in Nigeria.
Okay, thank you for that. So let's talk about challenges that you have encountered now in your current role and perhaps your previous experiences. How have you overcome them too? Because I want to learn from you, and I would like my audience to also learn from you as well. So if you can touch on a bit of that, yes.
Okay, so challenges from let me say, the users or the recipients of healthcare. So those are general population, patients, and all that. Getting them, um, basically, it's actually health literacy. People need to be more interested in their health. If you're not interested, you wouldn't want to basically take part in any healthcare program or any tech program. A good example I always mention is the fintech. You see, daddies and mommies that they don't know how to even like sign up online for HMO or do all those things. But if it's to transfer money, they can. They know how to use that app to transfer, which goes back to interest. So you need to make it interesting, valuable. You need to do a lot of sensitization for people. So that's one. Those are one of the challenges. So my previous roles and my current role, a lot of we emphasize a lot on patient education and counseling. Like, oh, yes, you've come to our hospital, our clinic, or our pharmacy, but do you know that you can also do this? So while they are getting their care, we also educate them on faster ways to reach their healthcare providers or to access particular services. Also, we don't wait for them to reach out to us. We also look for ways to meet them even at their homes, people that do home visits, telemedicine from home, and all that. So that's from the user side. On the user side, also economic challenges. The financial power to actually afford healthcare. Healthcare needs to be much more affordable. That's why insurance, HMOs, government, state and government health insurance, very vital to make it affordable. But it wouldn't make sense if you don't have the numbers. The more people you have on board, the more people that you have that are signing up, it makes a lot of sense in the long run. So healthcare financing is another aspect. In terms of the healthcare providers, so when I say providers, people always think it's only the doctors. Please, it's not just us. We have the labs, people in the nursing department, pharmacists, physiotherapists, a lot of people basically. Sensitization again, training. Our healthcare curriculum still goes on focusing on just the healthcare itself. Healthcare students or workers need to understand from the basis, right from our training in school, on health economics, health financing, the business side of healthcare, basically the administrative aspects, using technology also. These trainings should be incorporated into our syllabuses, and we see how, and when people come out, then become useful, because a lot of things we come out with is just, I want to treat a patient, but I don't know how to use the software. I'm stuck. So a lot of things like that. Then on the government side now, infrastructure, making resources available, healthcare financing, these things all come together. A big challenge is on data. For data, we need to have data that is synchronized. We need to have data that is safe. Patient data needs to be I'm very big on data, so I'm always mentioning data and everything. Data needs to be secure. How to overcome all these, where we can have one size fits all. For the government, we've had various interactions and stakeholder engagements. They need to see it happening first. A lot of people wait for the government to actually start something or reach out to you. What in my previous experience and current role, we actually start a solution, make that change. When the government sees that, oh, this is actually getting some traction, there's some behavioral changes in patients and healthcare workers, they're willing to partner. So I always advise people, don't wait to be reached out to. Go out there, reach out to the governments, look out for private partners also, collaborations. There's a lot of communication gaps, so that needs to be sorted out. Yeah, I think that's basically summarizes it. For majorly on education and giving people that interest, you'll be able to solve a lot of problems in healthcare here.
Okay. Thank you very much. Uh, we've discussed, the ideas of hospital leveraging services from entities like NIMSI, NIPS, to improve data management. I mean, you kept hammering on data management that is key in healthcare too as well. So personally, I believe that increased in collaboration between the healthcare sector and technology firms could drive significant progress in this area. But you're the expert here, Ashil. So to conclude, what are your thoughts on healthcare providers using technology or partnering with tech firms to advance digital health projects in Nigeria?
Hmm. Partnerships with tech companies, health and tech partnerships. Well, so there's an aspect or an industry that's seriously underutilized in Africa, in Nigeria. I've even searched for opportunities in that field, but it's not something that is popular here. Maybe in the next 2 3 years it would be. It's the aspect of health informatics. These are the guys that actually are the gatekeepers between the health guys and the tech people. So basically, with health informatics, that goes a long way. The health informaticians are like the translators between the health and technology people. So in terms of partnerships, in terms of how health and tech should go, we need a lot of health informatics professionals in Nigeria. It should be a course, it should be a career, actually. It's very big in places like Estonia, the UK, and all that. But here we just find people in tech that move to healthcare, or people in healthcare that move to tech. But it's actually a profession. It's actually a professional course or a professional career. So yes, in terms of partnerships, the technology people need to understand how healthcare works locally. A lot of times we see technology solutions that are of international standard, but not we can't adopt them to Nigeria, not practical. Also, the healthcare professionals that are moving into tech that have some healthcare solutions um, basically don't have their MVP yet. A lot of times there's this quick rush to launch. You don't have your minimum viable product yet. The product is not scalable, or basically is not yet fully operational. Now, not all the time they have to make it fully operational, but at least show some traction, have your targets, and so this is what I want to see. So everybody basically hesitates. The tech guys are hesitating. The healthcare people are also in a rush to launch or go to market and all that. So in terms of partnerships, I think a lot of transparency should be done. For the tech providers, I know the tech providers are always willing to invest, willing to partner in any healthcare solution that is viable. So I'll push it back to the healthcare providers that have solutions or ideas. Make it simple, make it practical, and a lot of partnerships will happen. My previous company, we had a partnership with Microsoft Azure. Did a lot of cloud solutions with Microsoft. I've done some programs or softwares too on some other cloud solutions. So it's actually good. I realized that a lot of people are willing to invest in healthcare here, provide telemedicine solutions, electronic health record solutions, even up to wearable devices, patient apps, and all that. So it's going to be very good as long as there's a lot of transparency and each side actually understands what goals that they want to achieve. Yeah.
Awesome, awesome. So I've learned a lot from your response to to this question. I'm hearing something now for the first time. You mentioned health informatics, right?
Yes.
Yes, in tech we have this DevOps, that will stand in between the very techy people and the developers. So now I'm hearing health informatics.
Yes. It's a very big thing abroad. And in
Yes.
fact, in the NHS in England, the UK, um,
Mm.
so they tried to implement a software for all the healthcare workers in the UK to use. Failed about 2 or 3 times, lost a lot of money. Then they realized, oh, we have health informaticians, and they all came in. They were the gateway keepers and translated everything between tech guys, the healthcare workers, everybody, and it was smooth, and that saved them a lot of costs and helped them with a lot of implementation. And they were able to launch, and now NHS is where they are now. So in Africa and Nigeria, if you check online for health informatics job in Nigeria, you wouldn't see it. You hardly I doubt if you see anything like that. You basically see someone in health records, a very small aspect of it. But basically, these health informatics people in this profession understand programming, understand healthcare. Usually they have a background in healthcare and you understand some programming, product management, project management also. So a lot of things, they learn a lot of things just a bit from everyone, and it's easy for them to be the gatekeepers. If we invest more in health informatics as a course or as a career here, it's sky's the limit.
Okay. I think I'm going to be looking up some more, after this call, or probably even reach out to you to learn more about or where I can get more resources around health informatics. I'm gradually also coming into your field, Cheryl, and I'm still wondering, yes, how do I get to integrate, my knowledge of tech with healthcare? So now you mentioned health informatics, and I think it's something that really interests me. Thank you so much, Cheryl.
You're welcome, Kazim. You're welcome.
Okay. But just before we close out, any last words?
Oh, stay healthy, be innovative. Technology is for you, is not an enemy. Healthcare is for everyone, and keep learning.
All right. So it's been awesome having you on the show, on the Tech Talk show today, and learning from you too as well. And I hope my viewers also have a lot to learn from this episode. Thank you so much. Don't forget to like, comment, and share. And if you haven't subscribed to the channel, please do. And so here is myself and Seun signing out, and I'll see you again next time. Bye bye.
Thanks, Kazim. Thank you, everyone. Bye.
Thank you. Bye bye.